Dr. Napolitano, what do you call when a person sees, far away? He can read the license plate of a couple cars in front of him. He can see the sign, the street signs, and all that relatively quite well, but can see his dashboard, or has problem with it. What are we calling this particular phenomenon?
In the medical term, that's called hyperopia. In lay term, that's referred to as farsightedness. Okay? So, in a nutshell, the reason why a person will be farsighted is the eye, the length of the eye, it's shorter than average. So, when you're looking at something, that image, instead of focusing on the retina, which is the film that sends the message to the brain, it focuses before the retina. So, we need a lens there to refocus the image. Or you might also be referring to something that happens later on in life, which is actually called the presbyopia, where the length of the eye is just fine, but that lens that we had talked about before when we were talking about cataracts just becomes a little bit too stiff. So it's not able to change focus between distance and up close as well as it used to when the person was younger. So those are the two different types of why a person will not be able to see up close as well. Okay?
So you're telling me one is farsightedness and the other one is needing reading glasses type of thing, and they're like having a relatively similar effect. They look similar. That's what you say?
It looks similar, but farsighted can happen at any age. We can have a child that is farsighted versus presbyopia that usually happens after the age of 40. So that's more age-related. And everybody's going to go through that process where focusing up close, it becomes just harder and harder to do.
Now, are the treatments the same whether you have nearsightedness, I mean you start having reading glass problem like the old things, or whether you're farsighted from as a child on? Is the treatment the same, and what are the treatments?
Sort of, kind of. A person who's farsighted, if we prescribe them single vision lenses, which is a lens that has one prescription all across, they're still able to see far away, and then they can see up close with the same pair of glasses. A person that has presbyopia, that it's older, and that's why it cannot see up close, if we give them a single vision lens, if we give them the same lens where it has one prescription all across, that person is going to be able to see everything up close, but then the moment they look at distance with that same glass, things are going to become a problem. Everything far away is going to be blurry. So for a person who is older and has presbyopia, we usually recommend more of a bifocal type of lens that would allow them, that has different prescription throughout the lens. Therefore, it allows them to see distance and up close at the same time without any problems.
Got it. What other options are there in terms of, like, you mentioned glasses now, and they may be bifocal or not, and then are there lenses, which, I mean, eye lenses one can put in, and are there any type of surgery available for it?
We definitely have contact lenses that we can use for both, whether it's farsighted or presbyopia. When it's for presbyopia, it's a little bit more complicated than just a simple farsighted. The contact lenses to correct for the presbyopia, because we also have to correct for the distance at the same time. We have to use either a multifocal contact lens, again, that has different prescription within the lens, or we do something called monovision, where one eye is mainly focusing at distance, and the weaker eye, the non-dominant eye, is focusing more up close. There is also LASIK surgery that can be done. The one for farsighted, again, it's very simple, straightforward. The one for presbyopia, I believe the only one that is available right now is the same type of concept, monovision, where the surgeon will correct one eye for distance and one eye for reading. But the thing to keep in mind with farsighted is that everything usually stays stable. Presbyopia, as you age, as time continues to pass, usually it gets worse. That's the one thing to keep in mind.
in which direction? I mean, I can understand that as it gets worse, you need stronger reading glasses or whatever glasses. That I can understand. You need stronger contact lenses. How is that fixed with surgery?
That's what I'm saying. That's the thing to keep in mind. If you do have surgery and you do the monovision to correct for the presbyopia, you have to keep in mind that maybe in 5-6 years you might have the same problem again, where the reading again needs to be adjusted.
Can it be adjusted? I mean, is that surgery possible to do twice, 3 times, or some surgeries you cannot do them too often?
Yes, but the thing to keep in mind is that because we are creating a imbalance between the two eyes, between your distance and your near vision, there is only so much we can do. We can never fully correct it because otherwise that imbalance is going to be too deep for the brain to work together with the two eyes, and you don't want to have double vision either. So there's only so much we can do when it comes to the LASIK surgery.
Got it. So the LASIK surgery, if your condition is such a condition which deteriorates, such as getting bad vision because of age, then the surgery might after a few years not work anymore. So
not be as
not
be as successful. Yes.
All right. At that point, one would have to then obviously go back to glasses again and substitute with
contact
glasses,
lenses. Right? Yes.
If it happens like that.
Yes.
Is there any major advantage or major disadvantage, glasses or contact lenses, or is it a very individual liking thing?
It's a very individual thing, except for a few rare cases. The one thing to keep in mind is that contact lens, you have to put them in the eye. So the person has to be inclined to touching their eye, because a lot of people just cannot do it. They cannot put themselves to touching their eye, put the contact lens in, take the contact lens out. So for that particular person, eyeglasses is definitely going to work better. Contact lenses are more fashionable, like if you're going to a party or an evening dinner, sometimes you don't want to wear glasses, so contact lenses become more fashionable. That's about it.
Okay, good. So it is an individual thing to a very high degree. Like I know, I'm not so sure I could ever wear contact lenses. Of course, I might be wrong. It's just because I can't put eye drops into my eye, or at least at this moment, I'm just, if it happens, forget it. My eye drops just wait before the drop ever hits the eye. All right.
Actually, one thing I'd like to add, to that is that sometimes we do have to use contact lens in cases where the two eyes do not have similar prescription. One eye has a much stronger prescription than the other eye. Then contact lenses definitely work better than glasses, because glasses, what they do is they alter the image size that we eventually receive, that the brain receives, versus contact lenses don't do that. So if the two eyes have two different prescriptions, then contact lenses are going to be definitely much better than glasses. That's the one instance.
Got it. All right. Thank you very much, Dr. Napolitano.